Klaus Madsen, Aalborg University. Thank you to all the speakers for brilliant presentations. So I have a very specific question to Özge concerning the role of, if any, I guess, the dynamic range of the display that you're using for experiments like these, or maybe not even dynamic range, but absolute luminance levels achievable.
Can you hear me? Yes, you can. Right?
Yeah.
Are you referring to this being displayed in different screens?
I'm just thinking that you're showing some participants some images of things, and those images represent, obviously they are meant to represent real spaces, but the reproduction on the monitor, the luminance levels there do not necessarily compare to the actual luminance levels of the depicted scene.
Yeah, indeed. I think this is obviously a limitation in the study. So what we try to do is, we try to equalize the luminance across conditions by using the formula that is suitable to screens. So the laptop screens or
small size.
Yes, small size screens. However, then this was an online study, and we could control that they didn't use cell phones, but we couldn't control the screens they used. So it is it's really a limitation in this case.
Maybe I can
yes,
add in this. I think you're also referring to the fact that, of course, in a screen the luminance is much lower than we would have with actual sunlight. This is definitely something on our mind as well, but we are, as a first pilot study in this direction, we're starting to look at the psychological effects of looking and recognizing sunlight patterns. And the next step, of course, is to not have control over the stimulus, but really have actual daylight conditions, which might change over time. We know that it's really tricky to do this in real experiments, to have stable lighting conditions. So it's a first step.
Yeah.
Thank you. We have a question over here. Thank you, Tina.
2 times?
No, it should be
It's on. Good. For Dr. Brembilla.
Yeah.
I found myself wondering 2 things. One, whether the rates of increase in myopia are linked in some cases to increases in our capability to diagnose and the rates of diagnosis, number 1. And number 2, when you showed a map of hours spent outdoors by school children in the European continent that went essentially from the Scandinavian countries down through Greece and Italy and southern Europe, I would have found it more persuasive if you were able to correlate the rates of myopia with those hours of exposure to outdoors. If your thesis is, if the medical thesis is that there's a link between time spent outdoors and visual acuity, or whatever the proper term is for normal vision, wouldn't then you expect there to be a high correlation between those, the rates of myopia and the hours of time spent outdoors?
Okay, I'll answer one thing at a time. And for both questions, please keep in mind that I don't have a medical vision myself. There are a lot of medical research already out there that proved what I've shown. So there's nothing that came from me directly. In terms of the rate and the, like being better at diagnose myopia, that's, I ask myself the same thing. That's actually not explaining much, because the strongest increase has been seen in Southeast Asia, particularly in places like Singapore and Hong Kong, where they've been pretty up to date with diagnosed techniques. So it's really increasing per se. So there is no more people being diagnosed with it. So that's pretty certain. In terms of the correlation between latitude, basically, or climate, and
you put it in terms of hours spent outdoors, and there may be a correlation.
Can you just use the microphone?
It's quite well proven that really the hours outdoor time is probably the only thing that has been proven. So there's been studies done and comparing the lifestyle of, again, Southeast Asian population and Australia. And the Australian kids were spending a lot of time, much more time outdoor compared to the southern eastern countries. So that was what really provided the strongest evidence for it. Now then, in Europe, we don't have that strong evidence. My map was more about the time that schools spend, the time that children spend inside schools, and the weather data that we can get about sunshine hours compared to overall hours in a year. So that it was to make that point that we cannot, even if medical doctors suggest to spend 2 hours outdoor, that's not always possible, just because of the weather condition.
My question would be then, does the data about rates of myopia back that assertion, that the time spent outdoors, if it's diminished, that increases the rates of myopia? I mean, in the European continent, in the diagram you showed, that was the question that came to my mind, and I don't expect you can answer it.
Yeah, well, I also don't have an answer. but it seems to be very effective spending more time outdoors. So that's definitely something we can all do and tell others to do, but there's limit to that. And another interesting thing in terms of the built environment is that they also found evidence of differences between rural areas and dense cities. So that even if you spend time outdoor in dense cities, it's not as effective as being in a rural area. So that's also very interesting in terms of the amount of light you can get even when outdoor.
Thank you. Thank you, Eleonora. And of course, people that are following us online, you can ask questions, and we have Ambra and Tina that are looking up. We have a question right there. Thank you, Nicholas.
I was just, thank you for those nice presentations, but I was also thinking about, have you done any studies, or the medical persons you were working with, have they done any studies about how the eye are actually exercising when it's outside, looking further away and nearby, because when you're indoor, you have a special range,
yeah.
And if you're looking outside and you have a nice view outside, then you also get this exercise of your eye. So are there any results about how the lens is actually getting a little more lazy if it doesn't come outside?
Yeah, that's another super important factor, and it is being studied a lot. There is no definite answer to what is most affecting, whether it's the light or the distance of focus. So it's very hard to separate the two, because the moment you have a better view to the outside and to the sky, even to the infinity, then you also receive more light at the eyes on the other hand. So it's super difficult to differentiate, but in our consortium, in the network that we put together, that was actually one of the things that we were hoping to study. With the use of simulation and different measurement way, and trying to see how, if possible, we can separate the two and find maybe some stronger effects when it's just about distance of focus or just about like light exposure. So it's I don't have a question, but it's a very, very important combination of factors.
Thank you. Thank you, Eleonora. I understand that we have a question from the
Yes,
online audience.
we do. And this is to all of you. On Kynthia's point on sufficiency and the pressure to reduce window area, we must keep advocating for the benefits of daylight, but we cannot dismiss the need to drastically cut research use. What could do a sufficiency-based approach look like when it comes to daylight provision in buildings? So how would you address the sufficiency-based measure when it comes to daylight in buildings?
Yeah, good question. It's again back to what we're discussing, I think, before, of finding consensus on what are, on one hand, what is the minimum, on one hand, what is our aim. Are we aiming for the minimum? Are we aiming for acceptable conditions? And for what? Of all the benefits of daylight? And can we really end at really a consensus and a united front of the field of daylighting in ensuring this and safeguarding daylight provision for the future? I don't have a better answer than that. Beyond, yeah, it's on our hands to join forces and really strengthen this.
I want to add one thing, and maybe I want to ask Marcel. We mentioned sufficiency. Is sufficiency sufficient?
Shall I answer that question?
Yeah. Okay.
Well, I think there are different definitions of sufficiency. Some people say, I also like to talk about sufficiency. And some people criticize that because they say, okay, I want to reduce people the opportunities, for example, to get daylight, to get an AC, and cool down their place to 18 degrees C in summer. But that's not how I see sufficiency. I think sufficiency is what we really need. I would say we should maximize daylight for people. I'm wondering whether we should have it all indoors. I think future designs, we probably should also look at intermediate spaces between indoors and outdoors. See how we can change our behavioral patterns for that. So for me, sufficiency is not like reducing it to the minimum. It's like really to reach what you need to satisfy your need. So we may discuss about satisfaction again here in this relation to sufficiency. But I personally don't see it as I don't want to restrict anyone. Even though some behaviors I might not do myself. I might not be my need to do it, being in a 400 square meter apartment, always cooled down. But I think if someone has this need for whatever reason, who am I to restrict that? We could think as a society to make it very expensive for that person to live that life, which is taking resources from others. But I think I wouldn't restrict this, and I wouldn't see sufficiency as reducing it.
Thank you.
And you, Sergio?
Well,
he cannot ask himself, so I help.
The reason why I asked the question is I mentioned semantics, and the fact that, I mean, I quite like the fact that Marcel said, I use sufficiency in a completely different way, or in a rather different way. And the question actually was also mentioning acceptability. And acceptability is something on which I think we could discuss a bit. I remember when Michael Kent is in the room, when we discussed the just acceptable glare threshold. Where does it sit? Is it before the just uncomfortable, or it should be after, whatever? So I think that whenever we do research, and whenever we apply a certain model to a reality that implies humans, we have to make sure, as I mentioned in my presentation, that what we mean by the use of our terms is exactly what the people that have, for example, to respond to a survey have understood. Otherwise, there is a very strong risk that we bias the results by applying a word, a term, or a model that is completely different from what people have understood. Then I go back to Marcel's, we have to comprehend people, and we have to make sure that people comprehend buildings.
Yeah. Well, about that, I think all of us not even comprehend our closest
exactly.
people at some point of life. But I wanted to add that we did a study on scales used in pain research, where if you go to a medical doctor and you have pain, they usually ask you, what is the pain from no pain to 10, the most imaginary pain you have. And we asked people in an interview, what actually is the most imaginary pain you would put there as the 10? It was a huge variety, which would lower the scale from, oh, someone poking me with a needle, to people imagining, I don't want to repeat that, what happens to them.
Something a little bit
that's, I think, exactly in your line. We need to make sure that we align with our questions, what people think about these questions.
Okay, it's one. I will let one final question, if that's okay. So I want to give you plenty of time for lunch and for thinking about what comes next.
Okay, thanks. Thank you for excellent talks, all of you. I wanted to directed to you, Sergio.
Lunch.
But basically, it's open to everyone. I really liked your overview of how we distinguish between the different terminologies. And then I saw your definition of comfort, and you took the definition of thermal comfort. I've looked into the definition of comfort in all 4 domains, and they are very different. I've seen definitions in acoustics that comfort is just the reduction of risk of hearing loss, which is, of course, very different from what you presented as thermal comfort. And I also heard that you said the visual comfort. And actually, in the visual domain, I think the definition of comfort is also quite different to the ones in thermal comfort. Did you take all of that into consideration with the different domains in your work, or how do you see that?
In the paper, I just presented the thermal comfort one because it's the one that is most commonly known. We had, in the paper, taken all of the different definitions of comfort that we found. But the reason why I'm putting that up is because if you ask people how acoustically comfortable you are, they may not think that I have to respond to what extent actually the signal I'm receiving is putting me at risk of having a sound impairment. So people do not know. And we still rely on surveys that are actually being collected with documents that just responded out of whatever actually they could possibly make of the question I've just been asked. And please do it quickly because you have to actually to go through a questionnaire of 180 questions. So yes, I perfectly agree. But the fact that we lack a clear definition of what is comfort, or anyway, we lack a clear understanding of the fact that in our interpretation, comfort is something that is very much transient and it can only live by here and right now. And that in order to feel comfort, you have to be discomfortable. You cannot have comfort without discomfort because comfort is transient. So you have to go from a discomfortable position to a comfortable. I could say from a comfortable to a more comfortable, but it doesn't make the difference wherever I put the benchmark. It's something that you get onto. It's a dynamic state, and that's what matters for the type of communication I want to make. No, guys, yes.
I just want to make a very short commercial because what Rune said, if you're interested in that, you can read it in the 10 questions paper Rune and I and several others published lately about the usage of scales.
Scales, exactly.
And all the challenges around that.
Absolutely. Yeah. Okay, and on that note, I think that we're all looking for comfort, satisfaction, health, well-being. We don't know. I leave to you to decide whatever you'll find in the room next to us where the lunch is served. And then I just need to remind you that at 2 o'clock on the main stage here, there will be a session on contact to outdoors and visual delight, and that will be moderated by Juliette. For daylighting tools, we'll be in the breakout space. And that will be moderated by me, which means that I need to know how the room is called before the session starts. Thank you very much, and enjoy your lunch.